The challenges are many. The services are limited. Yet, COVID-19 remains present in the country. It is boat time to Buvuma Islands in the central region of Uganda. Members of the Health Committee and the Parliamentary COVID-19 Task Force are headed for Lubya, one of the islands. Here, it is not good news for the fishermen. Due to lack of access to the markets, the fish is decomposing. They say this has been brought about by the COVID-19 lockdown that has paralyzed transport.
Omwo mwe tujja akasente n'ogula ki n'oliisa abaana n'osomesa abaana naye buli lw'otiikako akennyanja mu lyato kukwata lyato.
Omwalo gwonna amazzi gakola ki gagayingirira. Ekyo kyandibadde awo naye ate n'ekya karantini obutafuluma nakyo kyatumenye kinene nnyo.
The wish of the committee is to ensure that these residents understand that the lockdown is for their own good. This is because of the evidence of the presence of COVID-19 in the district.
Abasawo bakebera mukazi wange nga mulwadde ne batuleeta ffenna nga bwe twali mu nju. Kati nze ne bandeka wano omukazi ye ne bamutwala mu ddwaliro gye bajanjabira.
When 45-year-old Anatoly Kabajjo was brought at this isolation center, he was tested twice. To his relief and that of his handlers, the results turned out negative.
Sampe yasooka enfuluma nga simbi nungi ne bagamba nti ate baagala banjigyeko sampe endala. Kale sampe endala eyo nejja neerwawo okunzigyebwako.
We have screened 382 and we have tested 311 samples at UVRI Entebbe, and we have gotten all the results of 311. 310 are negative. Only one was confirmed positive, and that one was confirmed positive was referred to Jinja Regional Referral Hospital Case Management Center.
This could be some good news for now, but some not so good news could await the district. The isolation center is housed at a school whose permanency cannot be guaranteed, especially if learning institutions are opened.
The isolation center was at first in one of the halls next to the LFA Center 4, but it was too close to the LFA Center, so you would not meet the requirements of isolation. So it is actually a school. It was identified because it was the only place which was available.
I just can't imagine the situation if schools begin, because that is a school. That means we shall have nowhere to keep people who are suspected to be having COVID-19.
These are some of the challenges that the Buvuma COVID-19 Task Force enumerated to the committee during an exclusive meeting.
To discuss with the Minister of Health about the options of getting Buvuma both a land and water ambulance for purposes of ease of movement in the short term for COVID and in the long term for general patient management.
Unfortunately, such challenges have spiraled to other neighboring island districts. Whereas Namayingo may still be lucky not to have registered any COVID-19 case, the health sector is wanting. Sigulu Health Center 3 is a perfect example to this.
We have a fair infrastructure, but we need a theatre and also elevating this Sigulu Health Center 3 to a Center 4 and deploying the necessary staff in addition to the staff which is there.
When you are facing out Health Center 2s, we have some other islands called Wisa and Yeve. These are also under Volcano, but they are very far away, another 2 hours. So you find that it's very difficult for these people to travel, and sometimes also expensive. Hiring a boat from maybe Hamap to Lolwe, it takes around 300,000.
In this District 2 also sits a COVID-19 isolation center. Youthful men and women are seen in company of one another. As they await their fate, they were brought here on suspicions of being contacts to COVID-19 patients. This center is also housed in a school, which could be a disadvantage to the health department if schools are opened.
We are highly populated, but we are at the level of the health center 4 at the district level. So we have a very, very big challenge, majorly in the health sector.
3 women have died so far, maternal death, because of the situation, but they have told me even before the COVID-19 situation, women were dying like that, because they have no ambulance. Even Namayingo district has no ambulance. This is embarrassing.
Not all hope, however, is lost. The Ministry of Health is in the process of establishing a hospital in Namayingo.
They requested for us to get 15 acres of land we have got. Now we are in the process. They have finished leasing. Now we are just waiting for land title and we submit to the ministry.
Different islands from different districts, faced with similar challenges, are summary enough to describe the health situation in Namayingo and Buvuma Island districts. The establishment of the hospital will perhaps reduce dependence on outside clinics and traditional healers for health services.